This is the Brazil Institute podcast, brought to you by the Wilson Center. I'm your host, Anya Prusa. We have an incredible guest today, the award-winning journalist Patrícia Campos Mello, a reporter at large and columnist at the Folha de São Paulo newspaper. Last week, Patrícia and her colleague Eduardo Anizelli spent 3 days inside a hospital at the epicenter of the coronavirus outbreak in São Paulo. On this podcast, I talked to Patrícia about her reporting and the race to save lives in Brazil. Patrícia, it's an honor to have you on the podcast. You have reported from war zones and refugee camps in Afghanistan, Syria, Iraq, and elsewhere. Were you prepared for what you saw inside the ICU at Emílio Ribas Hospital in São Paulo?
Well, Anya, I had been reporting also on the Ebola outbreak in Sierra Leone. So I was kind of expecting the war zone scenario that we see in those situations, especially in developing countries dealing with an outbreak. At Emílio Ribas Hospital, it is a public hospital in Brazil, but it's one of the best public hospitals. It has a lot of experience with infectious diseases. So comparing to, let's say, Sierra Leone at the peak of the outbreak in 2014, it's still very organized. But the thing that we have to think about is, as many of the doctors were saying, we're in chapter 1 of this outbreak. I mean, this is only the beginning in Brazil. In the US, you are much more, you're ahead. The outbreak started earlier.
Mm-hmm.
So if in this very early stage of the outbreak in Brazil, we have one of the main public hospitals, Emílio Ribas, already packed, no free ICU beds, this is very, very concerning.
Emílio Ribas is better equipped than many hospitals in Brazil to deal with this outbreak. But what did you hear from doctors and nurses on the front lines? What are the challenges that they are facing? What type of support do they need right now?
There are many, many challenges. Well, first of all, it's a very good hospital, but it has already run out of beds. So if you would like to have, if you are unlucky and you have a serious case of coronavirus, it's highly unlikely that you will be able to get a bed in Emílio Ribas because it's packed. I mean, either you only have a free ICU bed if someone dies or if someone gets better and goes home.
Mm-hmm.
So this is one part. So they're already anticipating that this is going to get much worse. The other thing is the disease, everything is new in the way the doctors are supposed to treat it. So everybody is still learning along the way. Even doctors who are really experienced, they've dealt with several outbreaks, HIV, meningitis, and everything. So they're testing treatments and therapies with this disease along the way. So this is a challenge. And the other thing is there are not enough tests. They're not testing. I mean, unless you are unless you're very seriously ill and you were admitted to the hospital, then you get a test. But even then, it can take up to 3 weeks to get the results because there's a backlog at the main testing laboratory, public testing laboratory. So what we have in Brazil right now, it's a huge underestimation of the number of cases and even the number of deaths because of COVID-19, because many of them are just not getting tested or you don't have the results yet. And this is, again, just going to get worse because we're only in the beginning.
It sounds like the next 2 to 3 weeks are going to be critical for Brazil.
Yes, that's what all doctors have been saying. The next 2 or 3 weeks are very, very important.
Several possible treatments are being tested at Emílio Ribas as part of a broader effort to see if researchers can find therapies that show clinical evidence of helping coronavirus patients. Are doctors there hopeful that therapies can be developed?
They're not hopeful that anyone's going to find an effective therapy in the short run. I mean, there's no miracle medication. We have, our president has been doing, this public speeches and going on TV and say, and I'm not sure how to pronounce this in English, chloroquine? Chloroquine,
Yeah,
how do you say?
chloroquine.
Okay, chloroquine. He's a big supporter of chloroquine, just like President Trump. But I mean, what I hear from doctors on the front line, they're working every day. They're part of all the protocols, the WHO protocol. They're testing 4 different types of medication, some antiviral medications. Some of them were used in Ebola patients, and then the chloroquine and everything. And up until now, from what they've been seeing, again, this is not an official result, but they don't think anything works. What they're doing is try to make patients as stable as possible and try to deal with some of the consequences of coronavirus in the body. For instance, usually one of the consequences is that you get blood clots in your lungs. So one of the treatments, they are um, doing medication against blood clots and several different therapies just to make sure, or at least try, that very serious, very ill patients are stable.
We know this virus is very contagious, and medical professionals are at high risk given their frequent contact with sick individuals. Are doctors and nurses at Emílio Ribas and other hospitals in Brazil becoming ill with the coronavirus at high rates?
In several hospitals in Brazil, yes, there have been high numbers of medical personnel that's been infected, mostly because in some of the public hospitals in states as Ceará and Amazonas, where the system is already collapsing, they don't have the personal protection equipment. They don't have enough masks or gloves or everything, right? And even in some private hospitals in Brazil, in São Paulo, there has been a lot of infections among doctors and nurses. In Emílio Ribas, yes, some people have been contaminated while they were working, some doctors. The numbers are not so high because they have a very um, strict protocol of security, which they have been training. I mean, first time they heard about the outbreak in China in January, they started the training. And also they have something that not many hospitals have in Brazil, which is a negative pressure chamber before, I mean, next to every single ICU room where there's like one bed, they have this negative pressure room, which basically sucks the air and sort of avoids the contaminated air getting out of the room of this chamber. So this is a very specific thing. Not all the hospitals have this, and this does help to diminish the number of infected doctors and nurses.
I want to switch now to the issue of public policy, because in the absence of proven therapies or a vaccine, one of the main policy tools being used around the world is social distancing. There has been a clear divide on this issue in Brazil between President Bolsonaro and the state governors. Also, many Brazilians are in a precarious economic situation right now, and they might feel like they need to keep working. Have social distancing policies been effective in Brazil? Are people actually staying home?
Well, two things. Governors, just like in the US, governors are the ones that are really insisting on the need of social distancing in order to, as they say, flatten the curve. I mean, not have every single one, everybody sick at the same time, because then it would be a collapse. We don't have enough ICU beds or ventilators, right? So the governors are saying this, but the president is saying quite the opposite. He's saying, this is a dictatorship. These governors don't let you go out and work. We have to go on life as usual, blah, blah, blah. So the number of people, the percentage of people that have been following the social distancing guidelines is decreasing, which is a very worrying sign. On the other hand, there is big concern about how are poor people going to get by. There's a lot of people who have already been laid off. they need to work. And the thing that was a very big, I think was a weakness here in all the planning, and I guess there's not much planning, uh, how to help these people. I mean, I see in places like the UK, they were compensating up to 80% of the wages of people who were either laid off or whose contracts were suspended. The government was paying up to 80%. Here in Brazil, the things they are doing, the federal government is doing to try to help these people, either who can't work because their work is outside or because they've been laid off, it's just ridiculous, and it's taking forever to get to the people. I mean, the logistics of getting this vouchers and other stuff to people is not working very well. So you have two sides of this. On the one hand, governors really insisting on the need for social distancing, and the president defining the message all the time. And then on the other hand, of course, we have to understand that many people here in Brazil, we have a big part of the population that was already suffering because unemployment is high, and they need some sort of government support because they've been laid off or they can't work. And this is not, it's not getting to them quickly enough.
It's a very complicated situation, but certainly one of the priorities has to be slowing the spread so hospitals are not overwhelmed. We are seeing through your reporting and that of others that this is a real concern for Brazil. Looking at the next week or two, what indicators are you going to be following?
Well, we're following closely the number of ICU beds, the occupation in hospitals, because this is a very important indicator. I mean, São Paulo so far is doing okay. We only have Emílio Ribas that has run out of beds, but other hospitals still have beds. So we are following. It depends on the number of infected people that get to be very seriously ill people, right? The other thing is testing. I mean, there's been government has been saying that they're going to increase the number of tests available. Up to now, it's like ridiculous. No one gets tested, so and it won't be able to start gradually opening up and relaxing social distancing if we don't have tests, not even for people who have been admitted into hospitals. So this is the other thing we're going to be following closely, the number of tests, increase in testing in the country.
Thank you for taking the time to speak with me, Patrícia.
Thank you so much. Thank you for having me. Thank you.
I hope you and your colleagues stay healthy and safe as you continue reporting on COVID-19 in Brazil. Want to learn more? You can read Patrícia's full article in Portuguese at www.folha.ul.com.br. That's Folha de São Paulo's website. Until next time, I'm your host, Anya Prusa, and this is the Brazil Institute podcast. Thanks for listening.